So in this video, we're going to be discussing what types of questions you're going to see on the NCLEX exam. So there are two types of questions really. There's knowledge-based questions and then there's application-based questions. Knowledge questions are based on, do you know the facts, like do you know your symptoms of MS, Addison's disease, whatever, and do you know how to apply the information you know. So for example, you have these four patients. What precautions do you need to use for these patients, or what patients can these be paired up with? What's an inappropriate pairing? Lots of infection control based questions, but application just means you're applying what you know. So now that we're going to go through a bunch of different types of questions on the NCLEX, the first one is obviously multiple choice. It's going to be the vast majority of the questions. And the good part is that it's only A, B, C, D, and E. So only A, B, C, and D. There's no E, thankfully. So even if you don't know, feel free to guess. You're not going to be penalized for getting it wrong. Another thing to remember is that it can contain exhibits. So sometimes it will give you a picture or some extra additional information that you click on, and it pops up in order for you to answer the question. It's not really hints, it's more like it's part of the question. Like it will give you a MAR or something, like what is wrong with this, and you have to look at the MAR and see that oh, this patient can't get, for example, Tylenol again or acetaminophen. They can't get it again because they've already had it. And the order says once every 4 hours. It's only been 3. So that's kind of like an example of a question that will contain an exhibit. The second most common question is a select all apply, and basically what this is the fact that you get 1 to 5 options, just like you see here, and you have to get each and every one of these right. So you'll get a question, and then you're going to say, is option 1, is that correct or no? And you're going to you're either going to check it off or not check it off. And yeah, so in order to get the entire question right, you have to get all 5 of these boxes ticked correctly, and there are no part marks on the NCLEX. Other than that, just like I said, 5 options. At least 2 of the options are going to be correct, but it's possible for all 5 of the options to be correct. So you can see so you can technically check off all 5 boxes on the select all apply question. It's rare, but it can happen. Third type of question is text entry. Basically, you enter it's typically a number into a box, and these are used for the math question. So you'll have a math question, and then you're just going to type a number into a box. So it'll be like 8. You'll just type in the number 18 and then milligrams, and it will that's your answer for the question. You have to type it in there. You have no selections. That's it. Another one is labeling. So basically you get a diagram, kind of like you see here, and then you have to check off a spot on the diagram, and basically that's your answer. There's a box that in the program, there's a box that's like, this is the correct answer. If your marker lands anywhere in this box, the computer will automatically mark it as correct. You don't see that box, obviously it would give away the question, but the computer that's how the computer is set up and programmed. Examples of these questions include chest tube labeling chest tube chambers, like looking at medication labels, catheters, PICC lines, stuff like that. Example, where would you see the amount of blood drainage on this chest drainage system? And the answer would be, you would click over here. This is where all the blood piles up, and you can track how much blood has the patient lost through the system. Another type is ordering, and basically you get a list of options, and you have to drag them in the correct order. So you get approximately 6 or 7 usually options, and you have to use them all. So it's not going to be you're not going to be leaving any out. You have to put them all in order. of typically what you would do is what these questions are revolving around. So an example of this is like how would you insert a catheter in a patient? How would you respond to finding a patient on the floor is another one. This one up here is one I've pulled from UWorld, and it's how to give an IM injection, and you have to order it correctly. Obviously, if you get one out of place, the entire question is wrong. You get no marks. Another type of question is an audio question. So sometimes they give, well, they will always give you headphones. So if there is a question, you can listen to it. It doesn't disturb anybody else in the room. Headphones are provided. You can't bring your own. And typically, what these questions are, they're asking for like a heart sound, and like what lung sound is this, and then you get like a multiple choice part combined with this audio question. And the audio question basically guides you on how to answer the multiple choice question. So it's almost like an exhibit. And that's pretty much it for the types of questions you're going to see on the NCLEX. Like I said, by far it's mostly multiple choice and select all apply. I know on my NCLEX, that was the only thing I had. I didn't have any other questions. So if you have any questions, please comment below, and subscribe for new videos every week.